Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute pancreatic severity, that is a Glasgow scale. So for assessing this, let's look at. So within 48 hours, so we check for the age. So for the acute pancreatitis severity, so how to assess? We look for the age greater than 55 years. Next is the WBC. This has to be greater than 15 into 10 to the power 9 per liter. And the blood glucose. This is nothing but greater than 10 millimole per liter. And there is no history of diabetes. So there is no history of diabetes. Next is the serum urea. The serum urea is greater than 6 millimole per liter. And here there is no response to IV fluids. There is no response to the IV fluids. And there is the arterial saturation. There is something known as the arterial saturation. And this is nothing but of the oxygen. The arterial saturation of the oxygen. This is basically PaO2. And this is less than 8 kPa. That is a 60 mmHg. So before we go ahead, other points to notice: the serum calcium. This is less than 2 millimole per liter. And then we have the serum albumin. This is less than 32 gram per liter. Then there is also the LDH. LDH is greater than 600 units per liter. So let's recap. So for knowing the severity of the acute pancreatitis, we have the Glasgow scale. So within 48 hours, we look for the age greater than 55 years, the WBC greater than 15 into 10 to the power 9 per liter, the blood glucose being greater than 10 millimole per liter, and there is no history of diabetes. Next is the serum urea of greater than 16 millimole per liter, and there is no response to the IV fluids. So blood glucose greater than 10, serum urea greater than 16. Next is the arterial saturation of the oxygen, and this is less than 8 kPa. And then we have the serum calcium less than 2, and serum albumin is greater than 2, that is 3. So here we have 2, here we have 3, that is albumin is 32 gram per liter. Then LDH finally is greater than 600 units per liter. To learn and grow daily like this, please do subscribe.